I'm Father Joe Parkinson, Director of the LJ Goody Bioethics Centre in Mount Hawthorn, Western Australia. Even the strongest supporters of euthanasia eventually admit that the push for euthanasia isn't really about pain and suffering at all. It's all about self-determination and the right to end one's life as and when one chooses. They say euthanasia should be an option freely available to anyone who, for whatever reason, and regardless of their state of health, wishes to determine the time and manner of their own death. Have you noticed how Victoria's euthanasia laws are already attracting criticism because they don't go far enough? And remember, societies like ours only work if we're all prepared to give up some freedoms so that everyone can flourish. We call this the common good. Euthanasia works against the common good because it erodes a fundamental rule that lies at the heart of every civilised society, the rule that one person must not kill another. But, they will say, we can legislate euthanasia safely so that only the terminally ill or chronically suffering can have access to it. They forget that if we admit the power of today's Parliament to legislate for euthanasia in the first place, we have to admit the power of tomorrow's Parliament to amend those laws in whatever way they choose, including allowing euthanasia for those who are not terminally ill, who are not suffering pain, who are not adults, and even without the person's own consent. The only way to make sure that this kind of bracket creep never occurs is not to legalise euthanasia in the first place. Finally, despite the very vocal support from just a few doctors, almost all medical associations around the world reject euthanasia as being fundamentally incompatible with the physician's role as healer. As the American College of Physicians said in 2017, physician-assisted suicide breaches the first duty of the physician to do no harm. Now follow this logically. If we expect doctors to be able to kill people safely, and I suggest that that's an oxymoron, then they need to receive some kind of specialised training and accreditation. But do we really want every medical student to be trained in how to kill patients? The only doctors who support euthanasia are those who, for whatever reason, find it impossible to deliver effective care to their dying patients. It might be better to make sure all doctors receive specialised training in palliative care. After all, good doctors will always go the extra mile to learn how to provide the best care for their patients. When good doctors reach the limit of their competence, they always refer the patient to someone more expert than themselves. Good doctors care. Good doctors don't kill. Visit this website regularly to stay up to date with developments in this important debate. Use our contact page to send a message to your Member of Parliament that you don't want euthanasia. Use the same contact page to connect with us with your comments and feedback. Thank you for watching.